Good morning, good afternoon, and good evening to YPOers and friends around the world. I'm Julie Simon, co-chair of the YPO Psychedelic Medicine for Mental Health Group. And for the past 2 years, I have been facilitating psychedelic integration groups for YPO members. I've dedicated my life to advancing psychedelic-assisted aftercare, not only because of the overwhelming evidence supporting its effectiveness, but also because of my own personal experience. Currently, I'm the co-founder and CEO of Integro. Integro is an AI-driven integration platform redefining how psychedelic experiences translate into meaningful, measurable outcomes. With immersive content, vibrant community support, and facilitated live group sessions, Integro guides the journey between experiences. Over time, as the preferred solution for ketamine clinic state models, retreat centers, and solo practitioners, Integro will build the most comprehensive data set in the field to obtain FDA clearance as the first digital therapeutic focused on psychedelic integration and aftercare. And now, let's dive into investing in psychedelics. As the psychedelic space rapidly evolves, so too does the opportunity for impact, not just in mental health outcomes, but in how capital flows shape innovation, access, and care. Today's session will run for 60 minutes, with a Q&A session following my conversation with our guest today. If you have questions, please submit them via the Q&A feature on your Zoom screen, and we'll address them during the Q&A portion at about 40 minutes after the hour. Please note that this session is being recorded, and all registrants will receive a link to the recording. This is a great reason to sign up for future programs, even if you can't attend live. Today, you'll hear from some of the pioneer investors at the forefront of this movement. Lisa Barron from Seed Fund Capital, Simeon Schnapper from JLS Fund, Daniel Goldberg from Palo Santo, and Shelby Clark from Lionheart Ventures. First up is Daniel Goldberg of Palo Santo.
Hi. Okay,
Hold on, let me give you some spotlight here.
Okay.
All right.
Really?
So tell me, Daniel, how did you get into this space?
Well, for better or for worse, and this was an answer that that I didn't always give. It would depend on the year and the audience and how my wife felt about sharing our personal stories. But like most people in this field who got into it, it was really a result of my own personal relationship with psychedelics, which did not. Um, I didn't have historically have a relationship with psychedelics. It started. I'm 52 right now. It was 7 years ago, 2018, and started then. And I had a MDMA assisted therapy session at a time in my life when it was uh, very helpful. And that really was a major catalyst. I do feel very lucky that there was a 2 year period between that first um, trend, really shifting experience for me, major experience for me between that and starting Palo Santo. After that experience, it was a bit of a journey, which we use that word a lot here, but it really was a journey. And I started going to, I think it was 10 days after my first experience, I found myself in New York. I was actually there for a legal technology conference, and I saw that there was a conference called Horizons, which everyone on this, all the panelists here are familiar with. And I was lucky enough to meet Michael Pollan and many others. But it was a very special time. I think I was glowing from that first MDMA experience, and it gave me the courage to go up to Michael Pollan and pretty much tackle him and say, "Hey, this changed my life, and I'm from Chicago, and I want to get involved." So that was the beginning. It was 2 years of meeting academics and researchers, and my co-founder, Tim Schlitt, who we really spent the next 2 years together um, exploring and different ideas as to how we could get in. And I'll fast forward to 2 years later when COVID hit, we formed Palo Santo. There's a lot between that and forming Palo Santo, but those experiences and the people I met and the amazing the amazing community of researchers and academics and advocates. There were not that many business people. I met Simeon very early in this process. It was probably a year after that, or but it was right around then. And You had to kind of hide your business card. I was in venture capital, and I didn't want to admit that I was in business. There was a bit of an anti-capitalist bent that permeates the space sometimes, but we'll get into that. Yeah, that's how I got into it.
All right. Well, tell me about Palo Santo and the fund and how is it different from other funds?
Sure. Okay, well, you'll copy. It's good. Everyone gets to study my answers, and I get to go first, so then they get to shape. We'll get to, it's perfect. I'll take that risk. By the way, psychedelics has not cured me of speaking quickly or my gift of gab. So you cut me off because I know you have more questions.
You will be cut off. Yes. The next question's coming now. All
Perfect.
right. What?
No,
No, I'm just
what?
kidding. Just
That's
kidding.
good, Julie. Uh, when I first met Julie, I knew we'd be friends because first she was in Chicago, and secondly, she has a sense of humor. And I don't deal with anyone in this field that doesn't have a sense of humor, because if you don't have a sense of humor in this field, you're not going to survive. What makes us different? Well, we are really we have a $50 million fund one, which is almost, well, we've got about 10 million left to deploy of our first fund, and we'll soon be launching our second fund. We'll probably do our first closing sometime this summer for that fund. And both funds, they'll cross over, they'll do crossover investments. They'll have a very, very similar theme, although fund two is expanding even beyond mental health. Our fund is very much focused on therapeutics. I say therapeutics, it's primarily novel drug development, but we do have other investments. We're in, some healthcare delivery like Journey Clinical. I think we're partners. I think Shelby, I think Lionheart's in Journey Clinical with us. Fluence, we're in with Lisa's
Yeah,
fund.
yeah, that's
But
right.
about 80% of our assets, our capital, is dedicated to taking novel psychedelic medicines through the FDA. And I don't know how familiar everyone on this call is with psychedelic medicine for mental health, but you read a lot and it gets very confusing. You have the state, what's going on the legalization side, and you have state-sponsored, state new medical models that are experiments, legalization going on state by state. We are taking medicines through the FDA. And I would say the one thing I'd really love to educate everyone on, who's new to this, is that there's a lot more going on under the hood in terms of biotech startups that are very exciting, taking these novel medicines through the FDA. We are not related to cannabis. We're not related to recreational. I guess I should, not that there's anything wrong with that. It's like the old Seinfeld. No, we don't think there's anything wrong with that, but we don't think it's going to serve the greatest amount of people. We think the broadest access is going to be through our healthcare system, as flawed as it is. And we want to see the
So, Daniel,
reimbursement for insurance.
the idea is to fund things that will go through the traditional care delivery model as a place for investment versus kind of where we're coming from with other ways that people are getting access to these medicines.
Exactly. Now, the care delivery model may change a bit because psychedelics are so unique. We have sort of three different categories of medicines that we're investing in. I would say I would call the first one next generation psychedelics, which are very similar to the psychedelics that you may know. An example of that would be Reunion Neuroscience. I'll just pick one that everyone can relate to. It's a novel compound called 4-HO-DIPT, and that is a 3-hour psilocybin-like experience, right? So we're taking a 6-hour trip down to 3 hours. Why would we do that? Well, it's being investigated it's in clinical trials right now, phase 2 clinical trials for postpartum depression. So you can imagine in the model that we have now, if you have postpartum depression, you go to your doctor, you have very few options. There's one, I think Sage Therapeutics has a drug out there. It's not perfect. We think this is going to be better. It's going to get to the root cause, but 3 hours is important, right? If you went to get a colonoscopy and it was a 10-hour deal instead of a 2-hour deal, that changes the cost structure. And it gets to access and affordability. A lot of times we hear access and affordability, and it can be a bit of a virtue signaling. And we like to think of access and affordability as actually access and actual affordability, getting through insurance. So that's one thing. And then I'll mention those are novel next generation psychedelics. Then we have neuroplastogens, which you can read up on. I'll let you do your research on that. Companies like Gilgamesh, which I know Simeon and I are in together. And Gilgamesh is working on neuroplastogens, which are, among other molecules, but non-psychedelic psychedelics, right? Taking the experience out of psychedelics. That's similar. That's what we're familiar with in our current healthcare model, right? Why would we do that? Well, they might work for maybe not for every indication. They might work for certain people for certain indications. And a lot of people are screened out of psychedelic assisted therapy because they can't, if you have a history of schizophrenia in your family and others. So that's the second category. And I'll just mention the third are other novel pathways, which are psychedelic adjacent. And a good example of that would be like Tempero Bio, which is for alcohol use disorder. And it's a completely novel mechanism, but it relates to it's sort of psychedelic adjacent. So I think it'll fit within our current healthcare model if we're smart, if we're careful, and if we're creative and we're educating, like and also the kind of work you're doing, Julie, in terms of integration, right? And there's a lot of aspects that I don't know if that makes any sense.
Daniel, tell us one. Here's our last question, and then we'll come back and see you
Yeah,
again for the
yeah.
Q&A. But what's one lesson you've learned?
One lesson. There's a lot of lessons. It's been an interesting long 5 years. I think we saw, I don't even know if we can call it psychedelics like 1.0, 2.0, 3.0. This has been like dog years, I think, since Simeon and I first met Simeon. I don't even know how many economic cycles or booms and busts that psychedelics have gone through. A lot. Uh, and anyone you're seeing on this call, any of these panelists are survivors of those booms and busts. But bringing in, I would say, we're really focused on bringing in outside talent. We have, with our fund, we have the ability to bring in talent from biotech, pharmacology, interdisciplinary talent, and I think all of us have to be humble and continue to encourage talent from outside of the psychedelic kind of culture and field, bring from pharma and biotech and psychiatry, continue to do that because that's where we're going to see these drugs. That's where we're going to see the most amount of progress. I'll leave it at, if you take the example of Lycos, which is MAPS, which is always in the news. They had a huge setback this past summer. You can read up on all different theories as to why it was rejected or not approved at the first attempt by the FDA. The bottom line is we can all agree that it was largely because we need to continue to bring in talent from other fields that have experience, whether it's drug development or other interdisciplinary fields. It's very important. And I think we've learned a lot, and we're all trying to work with more and more professional teams that we don't consider
All
ourselves
right.
in the room. There you go.
Thanks, Daniel.
All right, you got it.
All right. Next up, we have Lisa Barron. Let's give you the spotlight, Lisa. So tell us, how did you get into this?
Like Daniel, I'm sure all of us have our own personal stories, so I'll spare you that. But part of that was important in terms of thinking about how this sector can ensure safe access and safe oversight of use of psychedelics. And I don't know, that might be a theme that's maybe more.
So are you saying, I know you wanted to spare us, but are you saying that you had also a personal experience that was transformative, like many people going into this space?
I've had transformative experiences, but I've also had, unfortunately, some really harmful experiences.
Also can be transformative.
Transformative. Yes. Thanks, Julie. Yes, it's a nice way to spin it. But and it really profoundly impacted me and made me really care about how do we provide safe access to these medicines. But then also spent a lot of time working in pharma with big pharma. And this was always sort of on the fringe. You've always found people in pharma who knew that there hadn't been enough research and development in mental health, in psychiatry, and CNS. And there was always this view of what was happening in the psychedelic space and the cannabis space, for that matter, and plant medicines generally. Um, and had a long time of studying the space, really deeply wanted to be in it. And when I started to enter the space, realized there was just very little capital um, that was accessible to founders. And I thought that's where I could probably put my efforts to most positive.
What's the reason you think there was so little capital in the space?
Well, there still is. I mean, the demand way outpaces the supply in the space. And I think obviously there's stigma against it for some investors. It's really interesting when you look at some family offices, there are like vice clauses, things like psychedelics can fall in there, rightly or wrongly. And so I think, to Daniel's point, some of how we frame our language around what we're looking at and what we're investing in, like our languages, we look at novel pathways for enhanced well-being, and it's really crafted in a way to ensure that the positive aspects, the proactive aspects, the help for humanity in terms of this space is what we like to focus on and talk about.
What is something you don't look at in this space?
What do we not look at in this space? Just like commoditize or like black market edibles and
Mm.
and obviously things that aren't legal. uh we are always looking more. We have three sectors that we looked at: therapeutics, so like Daniel was talking about, so the drug development and discovery; care and delivery, so that's more in the space of therapist training, insurance, how the whole ecosystem will deliver these medicines; and then personal betterment, so retreat centers, so people who are looking more for wellness than necessarily therapeutics.
Got it. And what makes your fund different outside
Um,
of those things? Like, I mean, you have an interesting. We've had the opportunity to speak beforehand, so you have an interesting women angle to your fund as well. Can you
yeah,
explain that?
sure. We look to prioritize investments to women-led organizations, and that could be co-founder, executive leadership, looking at the cap table. Fundamentally believe that as we're shaping consciousness and looking for mental health and wellness and enhanced well-being options, that women's voices should be part of that conversation. So it is a big aspect of how we consider and think about deals, but also it's a really great way to get deal flow. I mean, every time Daniel talks to a founder that's, a woman or a company that's focused on women's issues or women led, I'm probably the first phone call he makes to see if I'm interested. So that's always fantastic. But also we have we have a lower threshold for our fund than probably most VC. So we really wanted to make it LP focused and try to bring as many people into psychedelics as possible. Thresholds for VC investing are high already, high barriers to entry. It could be really hard for some investors to think about striking a big check that has a very long horizon, and especially in a space like psychedelics, where if we're doing drug development, the horizon can be very long. So we wanted to minimize those investment thresholds. So our standard investment threshold, our standard minimum is 50K. And then we also have a grouping set aside for women to come into the fund at a minimum of $5,000. So that was really important to us to try to bring more people into VC, lowering the threshold both for VC, but also into a space that could have some additional risk aversion. Yeah.
You mentioned that it could be difficult to come into this space. What would you say to a new funder who's interested today in coming into this? What should they consider?
Into psychedelics, generally into
Hmm.
the sector, well-being. Well, very long horizon. So I think what Daniel said, in terms of a lot of the drug development, and right now about 90% of the capital being invested in this space is in novel drug development. And it's hard. I mean, these are very, very risky investments and they're very long term. And, when you're dealing with the FDA or any government entity, there's always a lot of uncertainty in what those outcomes might be. So I think you have to be really ready to just sort of hang on and ride for a long time. And don't try to predict what the government's going to do in terms of any sort of regulation.
Okay. All right. Thank you, Lisa. We'll see you back for the Q&A. All right. Next up is Simeon Schnapper. Hello, Simeon.
Hey, Julie.
So, what's your story? How did you get into the space?
Yeah, my story starts 30 plus 35 odd years ago. I came to the space as a precocious teenager and curious, like most people do. Not through trauma, through, exploring consciousness and wanting to understand if there's more. So that started a couple weeks after my bar mitzvah. I remember being really like disappointed with the lack of mysticism and consciousness, and totally loved the right livelihood and all of that. And it was that same day that I remember my mom, it feels like she scolded me, but she's like, go to the basement and clean up a bunch of boxes. And in one of the boxes were two books of my dad's, The Dyadic Cyclone by John C. Lilly and The Only Dance There Is by Richard Albert, or Ram Dass. And I read them and I was like, nobody told me about this stuff. So kind of began my journey and was a student first and foremost. And then when I was like 16 or so, I met Robert Masters and Gene Houston, who wrote Varieties of Psychedelic Experiences. And they asked if I wanted to study protocols and substances. We were mostly working with LSD at the time. And that was kind of the beginning. And it's been 30 years of trying to understand all the nuances and complexities. Jumping forward maybe to about 6 years ago, when we started putting our first money to work, we saw some signals, basically regulatory, zeitgeist, the need, whether it was through mental health and COVID accelerated things, or the opioid epidemic, or PTSD. And I was able to fulfill the other side of what I've always loved, which was business. I like to say I've had a couple of nice exits, but a dozen really successful failures, where on the operator side, I just totally couldn't have been more wrong with product market fit and the idea and going to market. So bringing the two together was kind of the genesis, with some great founders, Lindsay, who I met in Shanghai maybe 16 or 17 years ago. I was restoring monasteries in Tibet and doing a whole bunch of stuff with their medicine culture. And Lindsay was passing through, and we said, hey, if there's ever an opportunity to work together, we hit it off, and we checked in. And yeah, then about 6 years ago, I don't know if she called me or I called her, but I'm like, hey, this is going to be the opportunity to merge healing modalities and mental health indications and early stage entrepreneurship and capital markets. And the fund was born.
You mentioned something in terms of your beginning, and I happened to see your advisory board with Leonard Picard on it. Tell me, what was the thought in bringing him on as an advisor?
Yeah.
And maybe you could explain to everybody who he is in case you don't know who this person is.
Well, for those in New York City, you should join him in about 2.5 hours at Neue House, where he's speaking. But he is, kind of known as one of the largest alleged LSD manufacturers, and just a brilliant mind. So shortly after his release, I, flew to Santa Fe and we started hanging out. And then whereas, like, I think we all have this, whether it's through indigenous communities and reciprocity, whether it's through criminal justice reform, whether it's through advocacy, that there's more than just making, or there could be more than just making, great returns for your investors and alternative asset perspectives with asymmetric upsides. And one of those things, at least for me personally and a lot of the other partners, was criminal justice reform and the war on drugs. So yeah, it was just great opportunity to do some direct work. Granted, if Leonard wasn't the most charming, enthusiastic, brilliant guy, there probably wouldn't have been that, hey, let's start working together. But it was very organic and very natural, and that was um, about 5 years ago. I'll have to look at that initial email. It might be time for like a 5-year anniversary, or hey, look at this first email. So yeah, we always endeavor to bring on advisors or support science fellows, doing a lot in CJR, public-private partnerships, a ton of governmental work internationally. And Leonard was just one of those brilliant dudes who you were like, oh my God, what a great honor to be able to support and work together. And did that answer your question?
Yeah, no, that's great.
Okay.
So tell me, in what ways have you found venture capital in the psychedelic space to be more challenging than other established fields?
I've always liked alternative assets and whatever those cycles are, just, for the opportunity. And, usually embedded somewhere in that is, a different story. So whatever it is. So for me, it wasn't dissimilar from other, alternative industries. I've been through it with blockchain compliance and cannabis and, a bunch of international impact stuff where, because of the nature of so many of these substances being Schedule 1, I don't think anybody on this call or in general, at least early on when we were all kind of starting, wasn't like, well, we opened our bank account. What's going to happen here? Because there were other parallel industries that had that. But, outside of that, I was really surprised. There's not been a single hiccup on the investing side of it from a compliance side whatsoever. And yeah, like 6 years. So I don't know if I see it that different outside of, just all the nuances of, 20 different, stars that need to align for, the regulatory shift, the power of the people, the differentiation between black, gray, the maturation or evolution or devolution, depending on who you ask, of psychedelics to psychoplastogens to now, when I'm on calls with pharma, it's, oh, we're working on a neuromedicine and look at this great, phase 2 data in our evolved neuroplastogen, which doesn't have a hallucinogenic effect, et cetera, et cetera. So, yeah, from a lived experience, it's, I don't think it's any more difficult, but certainly more fun. And yeah, as far as industries go, I say the parties, um, yeah, are bar none, and just the personal. And yeah, there hasn't been, as we've had a lot of LPs and some exits already, and yeah, there's not a single one I could think of who didn't come to it with hey, I've had some trauma, or my kid, or whatever it is. So that makes it really unique, and I think a little more human perhaps, but I guess we'll see.
What would you say to a funder who wants to come in and invest in the space and is a little bit confused between how the marijuana cannabis space went versus what the psychedelic space is?
Yeah. Well, again, and this isn't true of all the funds out there, but, and I'm echoing a lot of, what my esteemed colleagues on the right of my screen say, but this is above board, legal, FDA driven, or within jurisdictions. We're not, although we see a lot, because you have to look at the whole breadth of what's happening in the space. We see a lot of black market things, we see a lot of gray market things, but we don't necessarily, we're prevented, in fact, through compliance from investing in any of those. So when we're talking to funders, unless it's like the training of psychotherapists, with a lot of us on this call, I think are in on a lot of the same deals. This could have been the Palo Hard Seed LS just as easily, and when we all merge. But uh, yeah, 9 times out of 10, listen, this is a biotech play. There's something very special. There could or could not be therapy. Um, there's, VR, there's education platforms, there's wearables. We just did another deal today in a GABA de-risk drug development play, but from Fund 2, we're on Fund 2 now. We've deployed into 3 deals, and I would say, although there's great applicability and a parallel to true form OG psychedelics, none of them are quote unquote psychedelic deals. So we don't when talking to funders, it's not a hey, let's go to Burning Man together, although that's usually there. Or let's go to some great place to explore together on a retreat, or let's go to some, you know, jungle in the Congo Basin or the Amazon. Those are always appealing, but brass taxes, it's de-risk more or less. The majority of our investments have been in drug discovery and drug development, which is, as again, a lot of the panelists have said, is, not growing, a mushroom and trying to sell that in a state. It's more of the broad access with Medicare involved and private public partnerships and reimbursables and things like that.
Okay, great. Thanks, Simeon. We'll
Got
see
it.
you back for the Q&A in just a moment.
Fantastic.
Next, Shelby from Lionheart Ventures.
Hi, Julie. Nice to see you. Thanks for having
Nice to
me.
see you. Welcome, and I'm glad you could make it from Costa Rica today.
Pura vida. So it's like the motto of Costa Rica.
All right, and now the same question for you. How did you get into this space?
Yeah, well, I guess let me first start by saying that, I fully have dove into this space. So in addition to my work as a VC investor focusing mental health at Lionheart, I also run a LGBT-focused psychedelic retreat center in Costa Rica, where I live. And so I have deep alignment in my life, a lot of conviction, a very deep why. And that why comes from my background. So I guess I studied biomedical engineering undergrad. And then was a tech founder. I started a company called Turo, which is like Airbnb for cars. But today we'll do $1 billion this year. It's still growing, profitable company. And we'll put $1 billion in people's pockets all around the world. So I have a lot of experience in sort of establishing and growing companies. And this sort of took me to a point in my career where I had achieved a lot of achievement and was sort of really looking for more in life. And I found myself in a depression, and psychedelics is sort of what drew me out of it. So I had this experience where I felt deeply connected to the world that sort of sparked joy again. And this deeply shifted my experience, remembering that life was worth living. And pulled me out of my depression and helped me really see the value and the importance of these medicines. So from there, I got to see that there was an entire psychedelic renaissance that was happening, and that my perspective as with a deep business background, an entrepreneur, could potentially be helpful in this space.
So yeah, that's interesting because you're not only a fund manager now, you are also an entrepreneur at the same time in the space. Is that what you're saying?
Yeah, I think that I sort of have a deep perspective on the space in terms of both the delivery and the opportunities. So, it's I have a deep reverence for the possibilities and the need that's out there.
So tell me, what are you excited about in this space right now as a fundable place?
I think that we're at a really interesting time. I think that we are seeing the first glimmers of success. So, Spravato, the first approved psychedelic, is a $1 billion blockbuster drug. If it were a standalone company by comparables, it would be valued between $6 and $7 billion. And so, I think we're starting to see there is a huge opportunity and a market here. And I think that we also are seeing from some of the initial clinical trials the deep impact that's being had. There's a mental health crisis out there with treatments that really don't work. And so there's a huge need. There is treatments that are incredibly effective. And I think the market is seeing the first signs that we're ready for this.
All right. And what ways do you think this space has been more difficult?
um, Capital availability has been a real challenge. And so I think that what you have is, we've got four colleagues on this panel, all relatively early stage funds. And so we can write, relatively small early stage checks. Typically what happens in biotech is that pharma will come in. And so right now, pharma is sitting on the sidelines, and they want to see phase 2 results. And so that's sort of a phase B or a series B funding. And so there's sort of this series A gap that I think that we're seeing. And for us, we think that's an incredible opportunity. We can see these these incredible companies with really promising science and bets that we're comfortable with. And so when other people are leaning out, we're excited to lean in. And I think there's a real opportunity in this space. It has been a challenge. We also see that as an opportunity as well.
Can you explain more specifically the areas other people might be leaning out that you're leaning in on?
Yeah, I mean, so pharma or more traditional biotech investors, they don't want to touch any of these. They're very much leaning out on anything that has sort of a psychoactive effect, but really anything that sort of touches, psychedelics. They want to see phase 2 data, and so I think that there is an opportunity in sort of getting companies through their sort of this phase 1, which is sort of a larger seed or maybe a Series A financing.
Got it. So something's interesting about your fund is that you have kind of a special relationship with your founders. Could you explain what that entails and what's going on with that?
Well, I mean, I think that both. So, my partner David Langer and I are both founders, and so I think that we really approach this with deep empathy for what it means to be a founder. The emotional roller coaster. I'm sure that the YPO community can relate with this. And so, we've raised money from investors before, and we remember what it was like, how our investors showed up. And so we aim to show up with deep empathy. We aim to create resources for our founders, collective groups similar to a YPO, coaching networks. And right now, I'm greeting you from Costa Rica, where we have our annual Lionheart Summit. So we've gathered 140 people, our founders, LPs, thought leaders, facilitators, and have an incredible annual gathering for our community. So we'd like to show up and more than just with capital, but really sort of understanding what people need and creating sort of a deep community as well that can support the companies and the entrepreneurs.
Great, thank you. And what would you say to somebody who's looking to invest in this space and has not, is a brand new investor to the space?
I mean, I think I'd first ask them what their goals were. If they're looking for, a relatively quick return, I would sort of probably point them elsewhere. I think if they're ready to invest for the long term, then I'd say like, giddy up, let's go. I think this is an incredible time. I think that I see this sort of this Series A gap that I was describing as a bit of an arbitrage. I think that there's that the traditional sector is leaning out whenever there's a lot of evidence showing that these therapeutics are safe and effective. And I think that there's a real opportunity. And as I mentioned, I think with Spravato, we're seeing this is no longer theoretical. There is a real opportunity here. This is the first of many. I think that in short order, we will see the first sort of classic psychedelic approved by the FDA. I think that there's going to be both a really deep impact and a real opportunity to be had.
All right, great. It is now time for our Q&A session. So I'm going to bring everybody back. And we will go through the questions. So if you have questions, it is now time to post them. And we will go, and you are also welcome to upvote them here. So the first question is, how do you avoid extractive models in a space founded on healing. Extracting on healing.
I'll jump in here. So we have a really values or sort of principles-led approach at Lionheart. So we've actually, the way that I was attracted to my partner was I saw him presenting the Lionheart psychedelic investing principles. And so we've created an ethical framework, a framework of what we think it means to be an ethical investor in this space, including things like a focus on access, benefit sharing, or reciprocity where relevant. And it's a deep commitment to working with companies that that share this ethical approach. And one way you could see this sort of limiting the opportunities that we can invest in, but we haven't found that at all. In fact, we've really found that this draws people to us. It draws entrepreneurs to us. It draws other LPs towards us. Draws advisors and collaborators. This deep community that we have gathered here in Costa Rica this week. And so I think that there are some real concerns to be had. We'd like, we're here discussing those concerns on the ground this week. And I'm really glad that you asked the question.
All right. Anyone else on the extractive models? Comment.
I don't. I think this is it's a question that I wouldn't. I don't think anyone would get, like, if we were trying to cure cancer or kind of other disease states. It's an interesting. I know where it comes from, and it's such a very important question as it relates to plant medicine work. I really believe that, and some of the but I don't think we're going to move forward with. I think we have to rely on. This is science, and this is drug development, and I don't think, I joke around. None of us are in gold mining or silver mining here right now. We see where the problems have been, and we're acutely aware of that. I don't know that that always relates as much to the biopharma model as people think it does. I believe that's going to be like any other business. You're going to have good actors and bad actors, and it's easy to beat up on big pharma, what the Sacklers did and that whole story. It's a disaster. But we also love when there's great breakthroughs. And as much as it may be controversial, I'm a huge fan of what's going on with Ozempic and the GLP-1 agonists. There may be some controversy around how and when it's going to be used for whatever, but that is changing. That breakthrough is changing. Like, it could change the cost structure in healthcare right now. So I guess I have to push back on that a little bit and be the unapologetic. I don't know. Put on the capitalist hat here for a minute, knowing that there's a lot of problems with capitalism. But I think we have to kind of look. That is a very good question. I think sort of in the plant medicine world, and really for the underground, and for the space that needs to really pay attention to that, and we should all pay attention to it, but not be scared of moving forward to help people through the healthcare system, I guess. So.
I think that goes along with this next question. What responsibilities do psychedelic investors have beyond returns?
Yeah.
Simeon, what are your thoughts on this one?
Yeah, I mean, first and foremost, we're saying VC, so within that, it's capitalism, which inherently has been a model about returns, and there's dozens of other ones where you could have returns of impact. We seem to, from the fund's perspective, hang out more in the latter, the ROI. But then, as partners, and like, I'm just reflecting on, like, what was the benefit of helping to draft this first Congo Basin Accord a couple months ago between 4 countries, mostly around all the enthusiasm around Iboga and Ibogaine and TBI. And it's like, well, there was great intelligence there. I guess one could say there'll be reciprocity if these 5 countries all sign on, and those discussions are ongoing. If there's the presumption that the plant and the plant medicine will still somehow be a big part of how people, ingest and find these therapeutics. So even though we'll have like the next generation, all the neuroplastogens, there's still going to be the plant. Because if you look at the laws right now, globally, right now, you have to depend on the plant. There aren't the neuroplastogens that have gone through FDA trials to show efficacy. And even when there are, I think humans are humans. They're going to want to do it the way humans have done it since the beginning of time, which, is what's happening in some of the states. And I just flew in from, well, I pit stopped in Greece, but we were in Aspen for several days. And just being in Colorado, I hadn't been there in a while, and talking to local legislators and vets and um, 13 state senators and governors and AGs, it was like, wow, there's something really happening at the state level too, which is not a biotech play. It's a regulated kind of
Well,
med-
that's a great
Yeah.
great point, because our next question is, are you bullish on state regulated care models like Oregon and Colorado, or do you believe FDA pathways are the only real play? Daniel,
I think
I don't think they're the only
and
real
then Lisa.
Yeah, I don't think that, and just to answer your last question real quick, I think just real quick, beyond returns, I think our biggest responsibility is to advance these transformative medicines. And that doesn't always mean, it can mean making very tough decisions, and it can look a little business-like sometimes, as opposed to making everyone happy. We're not going to make everyone happy. We got to move forward. To answer that question, I think the state regulated models, it's very interesting. It's a giant experiment. I think it's well intentioned. I think the early results from Oregon, let's take Oregon for example, just objectively incredibly disappointing. I think it's it, one responsibility we have is to really pay attention and change our minds when we're seeing data, whether it's science or whether it's policy, and not get stuck in our stories. Because I was very pro Oregon. I didn't mind that they were tying it into the whole drug policy reform. Let's legalize all drugs. I thought that was interesting. I think it's a failure to tie it into a broader, like, all drugs are the same kind of thing. I think it's not true. It's not true from a science standpoint, and from a policy standpoint, I think it hurt the psychedelic movement. So I think it's an interesting experiment. I think what I want to read up more on the New Mexico legislation, which is very different, very interesting. But I think it's not going to get us where we need to get to in the long run. I think we need drugs through our healthcare system, where your aunt or cousin who has no interest in going on an ayahuasca retreat wants to get help and deserves a solution from their doctor where they can get reimbursed by insurance. I think that's where we're going to reach the most amount of people in the end.
Lisa.
Yeah, chiming in, I mean, I agree wholeheartedly with all that. I think it's tricky, and I don't think it helped. I think it helped in possibly mainstreaming the concept a bit more and bringing more visibility of the benefits of the medicine to more people broadly, and a little bit more kind of acceptance of it to, maybe your 80-year-old aunt, like Daniel was saying. But I do think there's always going to be that desire that humans have, like Simeon mentioned, for millennia to use quote unquote real psychedelics versus, the pharmaceutical approach that we're going to have to go through to have really, really wide access to have the most impact. So I do think there's always going to be that more local, more real psychedelic medicine approach. So I'm glad it's a good experiment. I hate that it was kind of compared to cannabis. It scares me when the legislation is developed that way versus New Mexico. I think New Mexico's approach might be more the way that we have to lean, but we'll see how it goes. To Daniel's point, it's still a big experiment, but at least it's mainstreaming the conversation a bit more and bringing more people into the sector and hopefully into the sector in a positive way.
Shelby, any thoughts that are different from the ones we just heard?
I mean, I see it as an and. I really think that going through the sort of the FDA channels is needed. We need this from a societal perspective, also from an investment perspective. I think that you're not going to get institutional capital on anything that is illegal at the federal level. And so you have to have the FDA in order for this to work at a societal level. And I think that there's a lot of limitations to the clinical model of healing a sickness. I really feel that a lot of the benefit from psychedelics can be in group therapy models, and they can also be in sort of around wellness, which just isn't compatible with the medicines that are being brought forward through the FDA. And so a psilocybin retreat that's happening in Oregon, amazing, or New Mexico. But I think it won't be able to achieve sort of the full impact if we don't have a basis in full federal level legality and deep scientific validation.
All right. Our next upvoted question here. What difference do you feel RFK Jr.'s endorsement have made to the acceptance of this space and the desire to invest in it? Does his position send positive signals in your opinion? Why don't we give a thumbs up or thumbs down?
I love that you brought politics into this. 6 minutes left. This is perfect. I'm just gonna pretend like my Wi-Fi cut out.
I mean, I think this is a good thing. We'd like to see tailwinds. I think it's great to see support from the administration. Who knows what that's going to mean? Is that going to change any policy at the FDA level? I don't know. Do I think might that change, an approval 6 months later or forward? Maybe. Does that change the overall trajectory of the sector? I don't think it does.
I agree. I'll wade in and be careful. I think that we want to find common ground. I mean, this is a really unique bipart. When I tell people, I know all the panelists feel the same here. When we talk about our field and you tell people who are new that we have broad bipartisan support, I mean, it sounds like it can't be. I mean, it sounds phony. You're like, oh, Trump got elected. It's actually good for our field. Yeah, okay. It's like, I worry in the long run that that's going to erode if we aren't focused on the science. And I try to stay above the fray maybe with the whole RFK Jr. thing because, there's various opinions on it, but let's if you disagree with him, let's prove it with science. If you agree with him, let's prove it with science, right? So I think that if we're going to be pro-science, if you're a voting Democrat, be pro-science all around. If you're going to, knock on the anti-science elements of the Democrat, if you're a Republican, then have it be real science. So I think that RFK Jr. is very interesting. Michael Pollan mentioned recently it's not a secret. He put this in a article, but I was talking to him about this, and he said, "Look, I agree with him on the food thing. I think he's dangerous on the medicine front." So let's have nuanced opinions and conversations around it, and let's try to find common ground because right now there's a lot of bipartisan support, and we're all benefiting from that. So hopefully that won't get ruined. Like we all agree that tariffs kind of were crazy, so let's try to stay away from crazy stuff. Yeah.
Okay, what regulatory milestone or shift would make you increase your position in psychedelics?
What was the question? Sorry.
What regulatory milestone or shift would make you increase your position in psychedelics?
I would say I have about 18, but the top three are rescheduling, all the emergency exemptions. There's a lot of heat around right to try laws right now. So there's a lot of these different like regulatory triggers that if any one of those happen, and I think a lot of people are expecting it as relates to, RFK, specifically in his role and kind of warmness and personal experience and family member experiences with many, quote unquote psychedelics or Schedule I substances that, this could be a really interesting time to deploy more capital into the space before there's any one of these regulatory shifts.
And by the way, we're seeing continued support through the FDA. There's a lot of misinformation about the FDA in there. I mean, maybe they tear it apart tomorrow and there's all kinds of drama. We don't know. This is crazy times. But the FDA is largely there's no indication that the FDA has in the past or now had any negative feelings or however you want to characterize it with psychedelics. There was a lot of misinformation after Lykos, a lot of emotions that flew around after the Lykos setback, and I think we all kind of reacted. And now you take a deep breath and you realize they still are a very professional organization. They make mistakes, but from what I understand, the people I know that have left there or that are there, it's very hopeful. They're very positive on this. So that's something that's very good for all of our investments on the biotech side.
And next question really quick, and then Shelby, I want to make sure we get you. You can comment on it. But based on Simeon's comments, do the panelists believe the psychedelic sector will consolidate into a few major players, or will it remain fragmented with smaller or regional leaders? Shelby, I know you wanted to say something.
Yeah, and I guess these are a little bit related, but I don't see a consolidation because there's a lot happening out there. I mean, there are dozens of molecules that are, either psychedelic or you can call it psychedelic inspired in many different sectors. And there's strong science behind a lot of these things. I think the science is really compelling and interesting, and so I don't like. And there's many different indications. I broadly think that we don't have many mental health treatments that work. I don't think that SSRIs are effective hardly at all. And so the bar is low for something to be better. And I think that we're seeing is a lot of specialization in lots of different sectors. And so, one thing that we've invested in is a company called 2A Biosciences, and they've taken a psychedelic inspired molecule that has been shown to reduce inflammation in the body. It acts on the same serotonin receptors and has transformative effects. And so, this is a completely separate area. So, I believe in the long-term fundamentals of this. I don't, to the last question, I don't think any changes in the regulatory perspective would change my opinion. I think that this is going to take time. I think that if we're investing for the long term, that there is, monumental steps to take, step orders of magnitude that will be made in many different indications that will make these things, the tools that we're using today, look like cavemen.
All right. Last words, Lisa, before I wrap up today.
Oh, great. Thanks. I totally agree with Shelby. I don't think there's going to be a consolidation of just a couple of big players. However, that's where all the money is going right now, to a couple of big players. I mean, we just saw all the Q1 investment went to like 3 players. So what we have to do is try to get more people to get more capital into this space so that we can continue to fund all these extraordinary breakthroughs that are on the horizon.
Wonderful. Thank you, Lisa. I want to thank our guests today, Shelby Clark of Lionheart Ventures, Simeon Schnapper of the JLS Fund, Lisa Barron of Seed Fund Capital, Daniel Goldberg of Palo Santo Fund. And if you're a YPO member with a business in the psychedelic field, please join us in a private signal group where we will be doing system catalyzing and working together to grow the psychedelic field. So you can find that link on the YPO Connect group, which is the Psychedelic Medicine for Mental Health group. And I will see you all next month for our panel on ethics in the psychedelic field. So thank you, everybody. And
thank you, Julie.
See you soon.
Thanks, Julie. Thanks, everyone.
Thank you, Lisa. Thank you, Simeon. Thank you, Daniel. Nice to see you all.
Good to see you. Have fun in Costa Rica. We're jealous.
All right. Goodbye, everyone.
Bye.